And we are joined now by a key member of the government's coronavirus task force, Dr. Anthony Fauci, who is the director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, good morning. Good to see you, sir.
Good morning.
The urgent matter this morning appears to be this matter of healthcare supplies. We've seen it on the front pages. We've seen it online, on TV. Doctors literally begging for equipment, which affects, of course, not only who they can treat, but whether they can even do these tests. How dire a situation is it if the CDC itself is suggesting maybe you use a bandana if you don't have anything else?
Well, I mean, obviously, when you have a seriousness of an outbreak the way we're seeing right now, there's going to be a significant stress on supplies, and that's what we're seeing play out right now. One of the things that can be done, it's certainly not the total solution to the problem, is to delay, if not cancel, anything that's elective. I mean, any medical or surgical procedures that need to be done on an elective basis should not be done in anticipation of the fact that beds and equipment that you would use even in an elective situation should be used for people who really need it. Even though you don't see that now in certain locations, pretty soon there's going to be a stress on everyone's system, and that's one of the things that can be done.
Yeah. I mean, we've seen these disturbing anecdotes, Dr. Fauci. One Seattle area hospital setting up its own makeshift assembly line using parts purchased from Home Depot and craft stores. The president says that he has invoked, in fact, he tweeted, he said, "I only signed the Defense Production Act to combat the Chinese virus should we need to invoke it in a worst case scenario." Now, that Defense Production Act essentially enables him, if he wants to order private manufacturers, private business in this country to help out and start manufacturing some of this stuff. He said he's only done it in a worst case scenario. Are we there? Is it time to actually act on it?
You know, literally every single day, multiple times a day, this is brought up and discussed. I mean, I don't want to get ahead of the president, but I can tell you he's very serious about doing everything we possibly can do. We're going to meet again today in a couple of hours, and I'm sure this is going to come up front as something of a very intense discussion.
What do you think? Is it time? What would your recommendation be?
No, I think we should do everything we possibly can do. I mean, in all sectors, because obviously, as I've said so many times, when you think you're maybe overreacting, you probably are not acting as forcefully as you should. So as we've always said, we've got to try very much to stay ahead of the curve.
Yeah, I mean, I guess it's just to put a fine point on it, if doctors are resorting to going to the craft store to come up with their own equipment to protect themselves, and we anticipate how badly we need them, isn't that kind of the worst case scenario that the president's talking about?
Yes, I mean, obviously it is. You're speaking the obvious. I mean, obviously we are in a very difficult situation, and we should be doing everything we possibly can to mitigate that.
Let's talk about some of these new therapies, new drugs that the president talked about. He said they were exciting, that the FDA has approved them. I'm talking about, I guess, and you can pronounce it better than me, hydroxychloroquine and chloroquine, which have been used in the past for malaria and for rheumatoid arthritis. First of all, has the FDA approved them for use for this virus? Do they work for this virus? Should doctors just go out on their own right now and prescribe them?
Well, I think the commissioner of the FDA, Steve Hahn, said it very well as the president yesterday, that these are drugs that anecdotally, without being done in a controlled trial, have some suggestion that they might work. We're getting stories from people who've tried them, but they've tried them in trials that are not controlled. So what we're saying is that we want to make them more available, but in the context of a protocol of some sort that would not only make them available, but that we can get some information as to whether they're safe and whether they really work. Because even though the information is anecdotal that they may work, we need to prove it so that people will get the right drug that's safe and effective. That's what the FDA was talking about yesterday.
Okay, so there's hope, but we're not there yet. Let me ask you about the virus itself. I mean, fundamentally, this is a novel virus. We've never seen it before, so we're all learning about it at the same time. There have been reports that the virus may be hitting the younger population more seriously than previously described. The CDC in particular says of the hospitalizations in the U.S., 38% were people between the ages of 20 and 54. Is there a new consideration that perhaps this is hitting the young more than was initially thought?
Right. You know, that is quite possible. There are a couple of things you want to look at. You want to find out if the people who are young and getting what we say hit more now have underlying conditions or not. If they don't have underlying conditions, many of them do, then we really got to carefully look at that data, because if you look at the data from China and some of the data that we've seen early on, clearly younger individuals had very little involvement of any seriousness. If this is true, which it might be, we have to relook at that and make sure. Another reason why, when we say young people should not consider themselves invulnerable, they should be doing everything they can to protect themselves from infection, not only for themselves, but for the possibility that they may pass the infection on to someone who's really vulnerable, like an elderly person or someone with an underlying condition.
Absolutely, Doctor. We've said many, many times that as far as we know, the telltale signs of COVID-19 are that shortness of breath, a fever, the coughing. Now that it's here and you're starting to get information from American doctors, is it presenting with other symptoms such as a runny nose, a sore throat? I mean, are you learning more about how this virus is appearing in patients in this country?
Yes, I mean, of course, the more patients you see, the more you learn. It really is somewhat of a confirmation of what we've seen from our colleagues in China and now in Europe. Generally, it is not an upper airway disease. That doesn't mean that no one will ever get an upper airway type of involvement. But if you have an itchy eye and a running nose, that generally is not associated. I mean, I've spoken to people, my colleagues who've been infected, and it's pretty consistent. They get fever, they get achy, they get a flu-like syndrome, they get a cough, they get a little bit short of breath. It isn't really a predominance of upper airway symptoms.
Let me ask you before we go about testing that has really been this persistent issue with regard to the response. Certainly, there's more testing than ever before in this country. You had famously acknowledged it when testing was failing. How do you grade it now? Are we where we need to be, or does more need to be done?
No, clearly more needs to be done, but we are rapidly getting to the point where we will have many, many tests out there available for virtually everyone. Early on, as I've said, it wasn't the way it should have been, but we're really now very much in the right direction, flooding the system with it. There are going to be people, for sure, who will call in and say they can't get tested. It's not a perfect system yet, but we're getting there very rapidly.
Real quick, here's the question that everyone wants you to answer, and I don't know if you can, sir, candidly, but we're all at home right now, including me right now in my basement. How long do you think that Americans need to be in this posture of staying at home and avoiding other people for it to work?
Obviously, that's obviously the question that everyone is asking. If you look at the trajectory of the curves of outbreaks in other areas, it's at least going to be several weeks. I cannot see that all of a sudden next week or 2 weeks from now it's going to be over. I don't think there's a chance of that. I think it's going to be several weeks.
All right. Dr. Fauci, I know you're busy. We so appreciate your expertise and being with us. Thank you very much.
Good to be with you as always.